Hi, this video is the art of hair transplant restoration surgery using the FUE method on an African client from England. Once a month I will have someone from England fly over for me to restore the hair using the FUE method. I do both FUE and strip. As you know, I'm one of the very few surgeons who specialize on restoring black curly hair using the FUE method. Using my technique through many years of experience, I invented the DFC technique. DFC stands for Diep FUE Curve technique. It's the most advanced FUE technique available that predicts where the curly root lies and go in a precise angle and harvest it out, because where the hair exit, the root could lie to the left, right, or any position. So my technique mathematically predicts with a certain amount of degree of accuracy and where the curly root lies and go in without damaging the roots and harvest it out. And we'll be attempting at least 2,500 grafts today. On average, I set it out at 2,500, but there are many days I can go beyond that. This client actually has pretty advanced hair loss. If you can see, it's a class 4, 5, class 5 to be exact, hair loss pattern. But he still want out the FUE because he does not want to go with the linear scar. The linear scar is very visible. Even if you leave your hair a little bit long, they will be noticeable, especially with black curly hair. So most men opt to use the FUE method because it leaves tiny dots of scar, allow you to shave your hair shorter. And it's not only less visible scar, but less bleeding, less chance of infection, less chance of numbness. Both technique leave scar, the FUE or the FUT, but the FUE scar is less visible. There's no hair transplant is not just the surgical skill of the surgeon, and I harp on that quite a bit. The surgical skill will give you the density, but the artistic and aesthetic detail is very, very important to give you the natural result. Is how the old day they say you should be happy to have hair, so they don't care about the artistic part. So some hairlines all the way half of the head, or it's really straight, or it doesn't look natural, it doesn't conform to the face. But when I create the hairline, I build around the facial structure of an individual, and so it's a custom hairline. But each ethnic hairlines are different too, and each individual is different. So we had to create around an individual hairline, really. From the mid-eyebrow to the hairline for black and Asian, around 6.5 to 7 centimeter. For Caucasian, it's around 7.5 to 8.5 centimeter. The more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. And for most African American men, or black in descent, the hairline is a light curve. And then not only when it compare black with other ethnic hairlines, the hairline is a little slight curve, but and lower, but the zigzag is smaller in amplitude. And why? Because most black men like to line up the hairline anyway. So we do such a big zigzag, and then when we line up, the hairline can be higher than it is. And not only the zigzags different, the precise angles is different. So when the exit the scalp is around 15 degrees for black men. For Asian and Caucasian, it starts around 35, 45 in the front, so it's higher, steeper for other ethnic. And then selection hair graft is important. We transplant rows and rows, single hair graft in the front, followed by root to go 2 hair, 3 hair, and 4 hair in the back for bulk and volume. So this client flew all the way from England, kind enough to allow me to show at least the forehead. He actually had had some kind of tattoo in the front, so I draw the hairline to hide it. But and the micropigmentation tattoo or just tattoo, it looks good in photo, but in reality it's not a 3D thing. It's very visible and in person, and it doesn't look natural, and through the years the color will fade too. So you'll be very conscious, because when you go and talk to people, you don't know the people deep in your heart or your mind, you don't know the patient. The people are looking at you and talk to you, or looking at your hairline. So I don't recommend micropigmentation on top, on the front, but it can be done in the donor area to hide the scar. So there's a place for micropigmentation tattoo, but it's not on top of the head at all. again, the color fade and it looks very awkward. So to fix this, and this part is to do a hair transplant and to put a hair inside it, on it, and then it will completely change. I'm very excited for this client because next year it will look different. Again, hair transplant not a perfect science. You're gonna need more than, sometimes you're gonna need more than one surgery to have better density, or as you lose further hair, you're gonna need more hair. And again, this client, he's gonna need, you know, minimum of 5,000 to even to 10,000, just because how advanced his hair loss is, heading to a 5-6 pattern. But 2,500 is front half first, and then 2,500 the back half. And most of the time it's good enough. But if you are a perfectionist, you can always add some more as you lose further hair. So this is the FUE method. Thank you.